Hi, I'm Dr. Jason with Carolina Value Pet Care. Today, I would like to talk to you a little bit about environmental allergies. So, this is a topic that's near and dear to my heart. I've been allergic to different hay fever issues, and crazily enough, as a veterinarian, I actually have a cat allergy. I'm almost embarrassed to say that. But over years, I've learned and worked with my allergist to come up with things to manage this allergy to the fact where I can see cats now all day long without my face like blowing up like crazy. So that's my goal too. And I see your pets coming in, and we see a lot with environmental allergies. There's a lot of things we can do to manage that allergy. Probably never going to be able to fully treat the allergy, meaning I'm not going to make it go away completely. But I want to manage that. I want to making sure that most of the time they're feeling pretty darn good. And yeah, they may get an occasional flare up, and that's going to be expected. Sometimes if I saw 30 cats in a day, I'm going to have some reaction to it. But on the major 99% of the time, I want to be able to manage your guys so they feel pretty comfortable at home. And then if there is a flare up, we can do some other types of treatment options with you and get those under control too. So, how do I know if it actually is an environmental allergy? A lot of times it's going to take during the consult time when you're speaking with us. I want to get a good history from you. I want to know, when did this first start? How long has it been going on? What areas are more itchy than others? And all that can help me figure out if this is an environmental allergy. I know most dogs with environmental allergies, typically around the age of 1 to 3, is when they first start showing some signs of it. It's even like 3/4 of our dogs with environmental allergies will first show signs within that 1 to 3 years of age. I also know there's some breeds that are way more prone to getting it. Our Goldens, our Labs, Westies are huge. Frenchies, Bulldogs, any of our Terrier breeds also will see it more likely. What happens with allergies is it is these environmental things. So a little bit is probably inhaled, but a lot of it actually gets in through our skin. Our skin is a normal barrier. It's supposed to protect us from weird environmental allergens that are actually causing a reaction. But sometimes our allergic patients, that skin barrier gets broken down a little bit. Our pores get more dilated. More of those pollens and danders can seep into our skin and cause these reactions to occur. We see it a lot in our mainly indoor pets too. We think about it, it's like, well, why is that the case? If they're indoors, they're not around the pollens and the danders. Well, unfortunately, everything outside kind of gets concentrated in our homes too, right? We got our HVAC units are blowing the air from outside. Anytime you open the door, all the air in your house has to come from somewhere, right? It comes from outside. And then we trap it all within our confined space of the house and kind of concentrate some of those different things in your couches, your carpets. A lot of that stuff builds up and then causes more reaction in our pets. So I'm looking for those types of signs. I'm looking, are they having chronic infections, meaning they're getting multiple skin infections, multiple ear infections throughout the year? Is there a seasonality to it? So is it kind of every time you're coming to see us for skin issues? I was like, oh, wow, it was right around April and May last year when you came in. Or maybe it was an October, November, fall time when you came in last year too. Well, maybe it's certain things out in the environment during that season that happens year after year that you're coming in to see us. So we're going to look at some of those issues that's been going on, and that can help me determine, okay, yeah, I think this might be an environmental allergen. And then we can kind of think about what treatment options we want to go with. Normally for treating these guys, are always worried about a secondary skin infection. So we have a normal amount of bacteria and yeast in our ears, on our skin at all times. When you have allergies, a lot of times your skin gets more inflamed. More inflammation makes it a better environment for that bacteria and yeast to grow. So if that starts growing more than normal, then that's going to cause even more inflammation, and then more bacteria and yeast grow, and then we get this cycle kind of going on each other. So I need to treat the infection if I think there is one going on. And then I also need to treat the inflammation too. And then we figure out what's our long-term strategy then to prevent this from recurring over and over again, to making sure we get this under control. So clearing infections, we may do topical type of therapies. So there might be some mousses or sprays or shampoos that have antibiotic, anti-yeast or fungal medications in there. Some of the topicals also help the skin barrier. Omega-3 fatty acids actually help the skin barrier if they're taking it routinely over like at least a 2-month period, can actually help that skin barrier inflammation doing just our omega-3 fatty acids. That's like our fish oil type of supplements, getting on a salmon, fish-based diet. There's other medications like steroids, either orally or injectable type of steroids that can be used to decrease that inflammation and itch. Oral medications may help decrease the itch signal in our body and actually kind of inhibit or stop or slow down that signal from ever telling my brain that you're even itchy. And there's injectable medications that do similar things like that too. They can kind of bind to the actual itch messenger that goes to our brain. And if I bind to it, then it never gets to my brain and my brain doesn't even realize that it's super itchy. Bathing your patient on these medicated shampoos or just bathing them in general can remove some of those pollens and danders and things they're allergic to before they seep down and get into their skin really bad. So all these things we can kind of talk about during our consult. If you have these issues or you think your dog may have an environmental allergen, definitely come in, check out our schedule, carolinavaluepetcare.com, see where our next clinic is going to be by you. And when you're checking in, just let them know that you'd like to speak with the veterinarian today about those skin issues. There is a small charge associated with that exam fee, but we're going to cover a heck of a lot of things on here. And hopefully, like I said, manage my cat allergies. Just like I want to manage your dogs and cats' allergies, making sure that they're comfortable for the duration of the time. And if there's a flare up of something, we can address that as quickly as possible to make them feel a lot better. All right. Thank you, everybody.